Welcome to today's webinar. We're so glad you could join us. My name is Amy Gohl, the Director of Education for the Partnership for Maternal and Child Health of Northern New Jersey. The partnership is providing today's program, Survival Roles in an Addicted Family. Just a few pieces of information before we get started. An hour after the webinar ends, you will receive an email with a link to a post-program evaluation. Please complete the survey to provide us with feedback on today's program. To receive a certificate of completion, you must listen to the entire webinar and complete the evaluation survey. Certificates of completion will be sent via email within 1 week of the web broadcast. This program is being recorded and will be available on the partnership's YouTube channel until April 15th, 2022. We will be muting all attendees' phones during the presentation, but we would love to hear from you. Please take the opportunity to write your questions in the question box. The speaker will respond to as many of those questions as possible at the conclusion of the presentation. And now I would like to introduce our speaker for today, Rachel Ugrinovsky. Rachel is a graduate of Montclair State University, where she received her undergraduate degree in sociology. She is a certified alcohol and drug counselor with over 10 years experience in the field of addictions. She currently serves as a perinatal addictions prevention specialist for the Partnership of Maternal and Child Health of Northern New Jersey, a position she has held for 7 years. Rachel is also a member of the New Jersey FASD Task Force and a certified fetal alcohol spectrum disorders educator. Please join me in welcoming Rachel.
Good afternoon, everyone. I am very pleased to present you with a very special presentation. It is a topic that is, it addresses a very important thing, survival roles in an addicted family. So whether you are an addictions counselor, behavioral therapist, medical professional, educator, administrator, or any other healthcare provider, I welcome you all. If you are none of the above, this information is equally pertinent to the general population. I like to think that one never really knows when we will be gifted with the opportunity to help another individual and even perhaps ourselves. As we all know, addiction does not discriminate. Therefore, we can all take away something by better understanding how simply adapting to dysfunction and chaos on a regular basis can have detrimental and even pathological consequences. However, becoming the light at the end of the tunnel, we can bring forth much needed hope when we least expect it. So let's begin. We have no financial disclosures to make, and approval does not indicate endorsement. So in order to receive credits, you must attend the entire webinar and complete an online evaluation. At the end of this webinar, you'll be able to understand not only the need for assuming these roles, but also how to identify them in order to provide the best possible support and guidance for individuals seeking treatment. The hope is that we can help these individuals utilize the strengths these roles require and learn to direct them towards a new and positive outcome. Our goal today is to provide you with a sufficient understanding of substance use disorders and how they affect an individual and the family surrounding them. Some of these effects are categorized by the development of certain behaviors and traits we refer to as the survival roles. Exploring these roles will also help you better understand the nature of codependency, generational factors, and treatment options for everyone in the family that is affected by addiction. Today, we will also explore what happens inside a home full of chaos and unpredictability, a home where an individual or individuals are struggling with a substance use disorder. Addiction is a disease which affects every single aspect of a person's life and the lives of those around them. As we identify and define the roles household members take on in order to cope and survive in this type of environment, it will be clear that not only the person that is using substances requires help, but just as importantly, the family members do as well. The American Society of Medicine is one of the most reputable resources in addiction research. All reputable resources defining addiction agree that it is a primary chronic disease of the brain, reward, motivation, memory, and related circuitry. The DSM uses the term substance use disorder at this time and provides specific criteria for the diagnosis. Whichever resource we use, the definition is the same and highlights progression, tolerance, and loss of control, to name a few of its indicators. Living in a home where someone has a substance use disorder has many consequences for the surrounding family members. Being repeatedly exposed to the tumultuous, unpredictable, and traumatizing environment resulting from addiction, some effects experienced by family members can be expressed in the development of specific behaviors that help them actually cope and survive under the pressure-filled circumstances. The person with a substance use disorder can be anyone in the family and is usually in a state of denial for a long period of time. This is in part due to the fact that they have a difficult time comprehending why they may suddenly be experiencing an inability to control their use of alcohol and or mind or mood altering drugs, or both. Generally speaking, at one time, they were in fact able to have control of their use, meaning how much, how often, and of course, the ability to stop when they wanted. However, at some point in their drinking and or drug use, they did what we refer to as, and this is not a clinical term, cross the invisible line from recreational, social, mainly controlled use into the term addiction or severe substance use disorder. So since the invisible line is not a clinical term, I'll clarify the consequences in the same manner. Loss of control in this regard it really relates to the body, and it's an inability to stop using once a person starts. Hence, there's a saying in 12-step programs, one is too many and 1,000 never enough. And this saying really relates to the physical component that is a characteristic of addiction or substance use disorder in a severe stage. Back to denial. So denial more than likely and unfortunately does accompany addiction in some fashion and for some period of time, because there is so much confusion around that as well. And often blame can be directed towards other people, places, and situations rather than the actual problem. So here is the diagram that we're going to be exploring and the names of the many roles that are developed out of a need to survive. And I just want you to take a minute and think about this question. Do you think that the roles acquired by family members are done so consciously or unconsciously? Okay, so I see a lot of great answers, and most of you did say that they are acquired unconsciously, and that is correct. Remember, we are talking about survival. So let's take a look at how these roles are actually defined. Remember, when we deal with addiction, we usually deal with, as I said, some aspects of denial. And whether it be the person with the substance use disorder or with those around them that are unable or unwilling to see the problem, denial creates chaos and damage to all of those affected by addiction. So while the person suffering becomes the center of the family's attention, with their aim being at getting the person to seek treatment, it's going to be equally important to acknowledge that the family members may or do need some type of treatment and support as well. Because living in a state of survival can have long-term residual effects that can be very damaging to a person's life and their ability to be happy. Therefore, rest assured that if you identify any of these roles within your clientele, know that it is possible for them to recover, even if the person in their life that is struggling with addiction does not. The attributes specific to each role doesn't prevent the acquiring of traits from other roles as well. Many times individuals can portray characteristics of a few of the other roles. This is a basic framework to better understand the key features with its problem areas as well as its strengths. These traits can become severe pathological problems which would require help in order to alleviate its symptoms. By changing thought patterns and behaviors, we can help support family members identify the strengths each of these roles required during the time of crisis and direct them in a positive and fulfilling way. So let us start with the hero. When we think about a hero, we think of someone that everyone looks up to. The person that is reliable, responsible, capable of taking care of everything and everyone. These natural born leaders attempt to bring order to the home, taking care of the household and its members. Our hero often neglects their own needs. Heroes feel a tremendous amount of pressure to be perfect in order to portray the illusion that everything is fine, therefore creating in themselves rigidity, fear, and control issues. Being laid back is just not part of their personality. They couldn't allow making a mistake of any kind happen because it would therefore bring attention to the real problem. Seeking help allows this workaholic personality type to tend to their own needs, relax, and enjoy life. Getting in touch with the root of their problem allows them to actively prevent the possibility of physical or mental illness stemming from their experience. So now let's take a look at the people pleaser personality. Sometimes people pleasing could also be the first addictive behavior that a person using substances or struggling with a substance use disorder acquires. People pleaser personality types often lack self-esteem. They look to please others for that specific need to be fulfilled, which not only creates an unhealthy relationship dynamic, but in turn creates dependency. When they get a positive response, it reinforces the behavior very strongly. If they continue on this path, their self-esteem will not grow and they can develop a very strong fear of rejection, which in turn perpetuates these behaviors into unhealthy and even pathological patterns in relationships and many aspects of life. Because of their caring and compassionate nature, with help, they are easily able to connect with others and become great additions to various environments and groups, redirecting their high tolerance for inappropriate behavior and treatment of because of a fear of rejection, abandonment, and dire need for acceptance. They can utilize their great compassionate nature towards developing a healthy and loving relationship with themselves, as well as those around them. Now, just as the people pleaser personality needs attention and acceptance, our scapegoat personality enjoys attention as well. They beneficially draw attention away from the real problem, but become compulsive, impulsive, rebellious, in part because they are not getting the attention they need to feel connected and nurtured, especially if this is a child, of course. Unfortunately, without help resolving these deep-rooted adaptive behaviors, they can get themselves into a lot of trouble by being destructive, defiant, and aggressive, by not dealing with the underlying feelings of shame, guilt, and a sense of emptiness. In a home affected by addiction, critical needs are not met and lead to the development of the roles we are discussing. I always like to lead with hope being at the forefront. These abilities are very unique to these individuals and can be directed towards much good. Providing support to the person labeled as the black sheep, which is the scapegoat of the family, can create a great level-headed business leader that can feel confident, in their own abilities and learn proper parameters for behavior. So, as we discussed a few of the attention-seeking personality types, this next role is quite the opposite. This is the child that stays out of sight. The lost child, in fact, becomes lost in the shuffle of the chaos. There is so much going on in the home that they are basically overlooked because of their quiet nature and are assumed to be okay, as in not needing attention. And we all know that that is not the case for anyone, and it's especially not the case for children. They may escape into a fantasy world and in order to cope with this lack, and can later on use this ability as a strength when they cease feeling withdrawn. Utilizing their sense of independence and flexibility, seeking help can allow them to turn their feelings of loneliness, lack of direction, and naivety into wisdom, creativity, and compassion. Moving on from our most quiet child to the mascot of the family, you can see how these roles are extremely different in the skills they developed as a way to cope in stressful circumstances. While they can be immature and distracting, their intention can be both good and a hindrance later on. The mascot loves to bring humor to the room and generally continues to be very immature if this behavior is reinforced and not addressed. Without help, they will probably continue on this path of irresponsibility into adulthood and make very poor decisions, mask their pain with humor, and stay very immature and detached from their feelings of shame and inadequacy. The mascot's confidence, such as the inability to stand in front of an audience and attempt to bring humor into a very dysfunctional and humorless environment, provides them with many strengths. With support, we can direct this attention-seeking individual to help lighten the spirits in difficult situations, become talented leaders, and most importantly, become confident in themselves and their abilities in order to live a successful and happy life. Unfortunately, we can't escape the damage acquired when living in a dysfunctional or chaotic household of any kind. And we have learned that addiction brings a great degree of both. The way to overcome these problems is we must first acknowledge their presence, then attempt to seek appropriate support, which we will identify shortly. Before we get into discussing the caretaker enabler personality type, I want to remind you once again that recovery for family members can happen at any time they choose to, even if the person with a substance use disorder is not or has not chosen recovery or treatment yet or at all. And of course, when family members have proper support for themselves and the person with the substance use disorder, chances for recovery also increase. When I say proper, you will better understand why as I go into further detail in describing the next role, the enabler role. So the enabler role allows the person with a substance use disorder to essentially remain in denial because they are constantly trying to clean up their mess and protect them. This is how they feel. It's done out of love and protection. So whether it be cleaning up their mess in a legal way, social, financial, or any other way, they attempt to remove consequences, hoping that the person with the substance use disorder will learn their lesson anyway. But it doesn't generally work that way because consequences force a person to look at their behavior and make the connection to their problematic use with the hopes ultimately of breaking through their denial, which is a necessity. Our enabler takes care of everyone else and overlooks their own needs. And in this role, ultimately, their focus is all on the person with the substance use disorder. So it allows the other roles to essentially become created and thrive. The person in this role also often feels empty and lacking of self-worth and will need to work towards regaining their independence, peace of mind, and sense of self once they stop removing consequences from the person with the substance use disorder and put the focus on themselves. They attempt to keep order in the household and essentially, as I said, by focusing on the person with the substance use disorder and overlooking the other people in the family, that is how the need to survive truly began, and that is how those roles began to thrive out of a need. Living in a state of secrecy and denial and chaos doesn't permit a natural process of life and growth. Hence, the development of these roles stemmed out of the need to survive in an unhealthy and sometimes dangerous environment. Addressing these problems would have prevented the need to survive, and in turn would have supported an ability to thrive. All of these roles can have great outcomes when they are addressed and healed. However, they have lifelong consequences, as we can see, if they are unaddressed. One term we use is codependency, also known as love addiction, created from a need to survive, take care of others, overlook personal needs, not only from yourself, but from others in the family. The codependent personality types can seek unhealthy healing by focusing on helping others excessively. This is self-destructive, as the core issue and reasoning behind this behavior is rooted in low self-esteem, lack of emotional stability, and people pleasing. Continuing to not have their needs met, they can become involved in unhealthy, even abusive relationships because of a distorted perception of self, of love, and of understanding what healthy even looks like. They may attempt to get the love they seek by giving it too much. Many times they are the only ones giving it, and even compulsively thinking the more they give, they will begin to receive, but that dynamic is usually unsuccessful for many reasons. Their distorted perception creates poor decision making and a need to control everything around them to avoid their own pain and live under the illusion that everything is working around them. Therefore, this slide is a great visualization of how a codependent person loses themselves by making the other person's needs and wants more important than theirs as a way to heal their own wounds. So with that being said, you can have a person that is in a codependent relationship that may have come from a home that there was chaos or dysfunction, and may have attracted the same type of relationship, but didn't really know that this was the dynamic that they grew up in, and sort of, you know, just perpetuated that cycle. So that is why understanding family roles as it relates to addiction is important in the healing process, because it comes down to awareness of how things are affecting us in the present day. So recovery really begins when you ask for help, when anyone asks for help. And we said the family members and friends of the person with the substance use disorder can get well whether or not the person with the substance use disorder decides to seek treatment or not. So seeking help through Al-Anon, Nar-Anon, or the many types of therapies, support groups, family members can stop engaging in unhealthy roles that they've developed and learn to direct their energies and strengths towards the betterment of themselves and their own lives. They allow the individual suffering with the substance use disorder to experience the consequences and hopefully seek treatment if they haven't already. But more than anything, they can reclaim their lives. Recovery for the person with the substance use disorder can begin and come from many different directions. There are detox units, inpatient, outpatient treatment programs, halfway houses, three-quarter houses, 12-step programs, and more. Learning to acknowledge, accept, and utilize support towards changing the problem, they can move towards a better life, find acceptance, and learn to forgive themselves for the consequences resulting from a substance use disorder, and learn new ways of looking at and dealing with all of life's circumstances. We have also included additional resources, and our website and Facebook page are regularly updated in order to provide you and your loved ones with the most current resources available so that you can begin your journey to heal and to recover. So I thank you all for your participation. And I'm looking forward to all of your questions. Thank you.
Thank you, Rachel. That was a wonderful presentation. We do have the questions coming in. And the first one, I think we should go to this one first, since you just spoke about codependency. Can you explain a little more about codependency?
Okay, so the term codependency, dependency in and of itself is relying on something or someone outside of you to give you what you need. And that term really surfaced in the 1930s when alcoholism and other drug addiction began to be understood. And if you guys aren't into history, I read a lot about, the history of drug and alcohol addiction treatment, and it really started a lot with 12-step programs and addressing not only the person's recovery, but there was a lot of family involvement and talking about really how family members were affected. And so that term later on was brought into treatment probably in the 1970s. The term really started to become used a lot because people that were getting sober began to need more treatment. Not more treatment. They were identifying that there were underlying issues that dealt with adverse childhood experiences, and some were the result of growing up in dysfunction themselves. And so, it really has to do with, just as drug addiction has to do with being dependent on a substance, and even when a person stops using the substance, there is it has to do with the reward, the motivation, the way that the brain adapts, the perception. It's the same way that with codependency, you start to look outside of yourself for esteem, for feeling good, and it's complex, but it's not. It ultimately is really about relying on things outside of you to make you feel good. And with codependency, we often attribute that to people. And so when I talk about the cycle, you could have somebody that is in a codependent, and I'll give you an example to make it more clear. So a codependent relationship is really about if you don't have a healthy self-esteem, then you can be in a relationship with somebody and become codependent on them to make you feel good. And when they're doing something that doesn't make you feel good, then you feel bad. And so you're emotionally unstable because your emotional stability comes from something outside of you. So codependency is really about a lack of esteem and love internally. And when you look outside of you, whatever that is, it's especially with other people, it's when you look outside of yourself to get those needs met. And like I said, it really started, the term dependence, codependence, it started when we started to understand that addiction wasn't about moral failure, and that happened in the 30s. And as treatment evolved, they started to recognize that it wasn't just about the putting down of the drink and the drug. There were underlying issues. And then as people re-engaged with their families, they started to see that there were patterns of behavior that were acquired as the person was growing up, or during the time that the person was addicted, the family took on certain behaviors, and there became a need for other programs helping the family to recover and learn how to be a proper support. have a term called enable, like how do I properly help the person that's suffering with addiction, and not enable them? Like how do I stop removing consequences so that they can experience the consequences, but I love them so much and I want to help them get into recovery, so I keep removing the consequences. Well, that's not a good way to help somebody. So the family gets sick just as the person that has a substance use disorder gets sick. So the term dependence grew out of an understanding of addiction. And so, and then it grew beyond that, because it didn't just have to do with people that were struggling with alcohol and drug addiction. We started to realize that codependence can happen when somebody grows up in any type of dysfunction and develops any type of lack within themselves, that they start to seek something or someone outside of themselves to fill that void. And when you do that, we all know that when you seek something outside of you to fill that, it's not stable, because people will give or not give. And so your reliance on something that isn't going to always provide. And so based on that, it's like, it's unhealthy, and it becomes pathological, and people that don't have substance use disorder that are codependent can get just as sick from being codependent, because they're lacking self-love and self-esteem inside of themselves.
Thank you. Rachel, I just got another question that kind of piggybacks off of what you're talking about. Someone asked, they said that they know of someone who wants to quit but does not know where to start. How can we help?
So depending on, they can call their insurance, or, if they need a detox, so they can always start there to find out if there's a detox. The family you can go online, you can find out what resources, while the person that is struggling with substance use disorder can find treatment and meetings for themselves immediately, and the family member or friend can find resources for themselves to educate themselves, so that they can go hand in hand in this journey and, be supportive to one another.
Great, thank you. And then this is, I think, a little bit unrelated. I'm not sure if you can address it, but since one of our listeners did send it in, I will read it. Can you talk a little bit about what a drug court does?
Okay, so drug court, they have certain guidelines in terms of what your charges are, like the nonviolent, you need to find those details out, but they have very strict guidelines, and they basically allow you to, instead of serving your time in jail, if you meet their requirements, you can, live on the outside, but they have, very strict guidelines, for work, for meetings. So, like I said, it gives people an opportunity to not serve their time in jail, but their rules, they're very, very strict, but it works because they are very strict. So, it, like I said, it's very strict, it's very supportive, but if you meet the requirements in terms of what your crimes were, it does work, because you have that. It's not just intense, it's not counseling, it's monitoring, but you have to follow guidelines of, you're showing up there about 4 times a week. There are different stages. So I think the first stage, you're showing up there 4 times a week. You have to get a job within, and don't quote me, but it could be within 30 days, and housing, you have curfews, urine screens. I think that they started as 5-year programs. I think maybe you can be released in a little bit less, but they're very strict monitoring programs with a lot of guidelines and fulfillment requirements.
Great, thank you. And so getting back to our topic now, want to talk a little bit about the different roles. How would a person know if they acquired some of the traits that you listed for a role, if they acquired it while they were growing up?
I think the easiest way is if something isn't working in your life. I mean, if things are working and you're happy, I mean, personal growth is great, but I think the biggest thing is if you start to have a problem and you seek help, it's just important to be open and talk about your family history, and just be willing to look at family history. I often tell people that when you start to peel away the layers of the onion and look at how things have affected you, it's never about blame. That's not what the process is for. It's that, okay, let me look, let me see how these things have affected me, let me make peace with it, and let me then move on with my life and get better.
Thank you. And can you explain how learning don't talk, don't trust, don't feel will impact relationships as an adult?
Well, when we're not allowed to express how we feel, we don't develop a healthy, self-esteem, a sense of self. There's a lot of fear that we can develop, fear of people, fear of life, fear of making decisions. So that can look like a lot of different things later on. Fear of getting close to people. We may not be able to develop healthy relationships. We should be able to express how we feel. And I always tell people that the things that we experience growing up will affect us as adults, and we need nurturing, we need understanding, and we need to be able to express ourselves. And if we're not able to do those things, then it can, affect our relationship with ourselves and with people around us in negative ways. And, everybody wants to be happy. So like you had asked before, if we're having problems, that's how we know that things affected us. So we have to keep searching until we find an answer that makes sense to us.
What would you say is the biggest challenge that people have as adults if they've experienced growing up in a home with someone who's struggled with addiction?
Biggest challenge, I think that when there is chaos and it's obvious, that's easy for people to look at. I think that when people start to get better, it's always actually very hard to look back at the first relationships in our lives with our mothers and fathers or caregivers, and see how they have impacted our current relationships if we're having problems. That's never an easy road to go down, and a lot of times the resistance is there for 2 reasons. For one, if there is anger towards the parents, there's resistance because of that. I don't want to look at them. I don't want to think about my parents or my mother, my father. The other side is when people are in denial about the possibility that they could have had adverse childhood experiences and think, no, I had a great upbringing. I had a great relationship with my mother and father. That could not be the reason why I'm not, able to experience a great, relationship. It's a very, very hard thing to start to look at. We're not really wired that way. We put caregivers on pedestals essentially, and there's nothing wrong with it. We're not doing this to live in anger or blame. We're doing this as a way of healing and moving forward. So there's resistance for those reasons, definitely.
Got it. Do the excuse me, do the roles ever overlap? For example, can a person switch roles, or can they play more than one role in the family?
Absolutely, absolutely. I think the framework that we give for each role gives people an idea so that they understand what happens in a family with dysfunction and chaos as it relates from living in a home where somebody is struggling with addiction. But you can absolutely take on the characteristics of other roles. 100%.
What happens to the family members who've assumed these roles when the addict becomes clean and sober?
So a lot of times, because they've taken on these roles, they seem to step into the old patterns. So if you have the enabler, the caretaker that hasn't really gotten help, they're going to want to do the same thing, overly involved and doing things for the person, which is not healthy, still overlooking their own needs, and because of the codependency, when the person that is trying to, get better is going to meetings and treatment and trying to separate, they can be hurt by that because they've been there helping the person the entire time, and now the person needs some separation. And so it can be, like I said, very hurtful. Other family members can feel angry as well, and have their own feelings, like we looked at when you don't address the roles that you take on, what happens as an adult when you don't address those issues. So there's a lot of blame, especially when, like I said, when the person gets well, a lot of different things can happen. They can be hindrances because people will stay, patterns of behavior are very hard to break. So essentially, everybody can be doing what they always did, except you have somebody that's now trying to get better and everything else is still the same.
Got it. So what does the research say about how long in general it takes a family to get help?
So, there's different information out there. I like to think that the family, if the family is getting help as well, because again, it's taking some action, not just, I want to say not just, you can not take any action or initiative to find out, how the person in the family that struggled with addiction has affected you in your life. But if, people are willing to get the help they need, I think that families are, 6 months behind the person that is in recovery. So yeah, 6 months, a year, I would think. And again, don't, quote me on that, but I think that's a pretty good timeline,
Okay. Thank you. And so we had some questions based on what people who play the various roles, where they kind of end up career-wise. So I'll group those together. What type of profession is someone who's a people pleaser drawn to?
So people pleasers can work in, the helping field, roles. It could be nurses, social workers, things like therapists. Is that good or bad? The most important thing really is to make sure that you're taking care of yourself. There's nothing wrong with, coming out of that environment and then deciding that, you want to be in the helping field or even become a therapist or substance abuse counselor. Just like for any other therapist or person in the helping or medical healthcare field, it's always important when you're taking care of other people to take care of yourself, because you don't want to project your issues onto your patients or clients.
Thank you. And I'll combine these two. Is the hero the individual who as an adult will become a CEO or be very high level in their work environment? And on the other hand, is it true that the mascot can grow up to become a professional comedian, that they have that kind of personality?
There are no hard and fast rules. The hero is so rigid and goal oriented. Yeah, I mean, they can grow up to become a CEO. They can also become so consumed with work and become workaholics that, their life becomes out of balance. So while success is something that we all would like, being out of balance and not having healthy relationships and then becoming physically or mentally ill because of that lack of balance is not good either. But the fact that they were the ones in the family that kept everything together really shows that they can take initiative. They're great at organizing. So they are great at that. But again, always finding balance. But all of these other roles can go on to become CEOs as well. But again, it's that personality that, we do find does thrive in that role. The mascot can definitely become a comedian because, they can stand up in front of people, and it does happen sometimes. So like I said, the roles can become different, can go to different professions, but what's natural to us is usually sometimes the direction that we go in professionally as well.
Thank you. I think we have time for one more question. So bearing in mind our current COVID-19 pandemic, the question is, how have AA, NA, and Al-Anon groups adapted to social distancing?
So you can attend virtual meetings. I know they're doing a lot of meetings over Zoom. So this has actually been, from what I hear, wonderful. You can go online and find, a meeting pretty much at any time, at any place, and hear and connect with people that you wouldn't normally connect with, people across the world. So while it's not the same as, the human interaction, people are finding that there is something really nice that they are experiencing from meeting people that are halfway across the world, and they're putting together conferences that are virtual conferences, and so they're making do. And from what I hear, it's successful. you know.
Well, that's good to hear that they're still able to provide that support
Absolutely.
for the folks out there that need it. I think that's all we have time for today. I'd like to thank you again, Rachel. It was a great presentation, and thank you for all your great responses to the questions. I'd also like to thank Monica Smith and Laura Hall, who were handling all of our background technical work today. And I'd also like to thank everybody who joined us for the webinar. A reminder that in about an hour, you will receive an email with a link to a post-program evaluation. Please complete that. If you want a certificate of completion, just note that on the evaluation, and the certificate will be sent to you via email. When you enter your email, please make sure, double check it, that there are no typos in it, so that your certificate gets to you, and you will receive the certificate within 1 week of today. A calendar of the partnership's upcoming virtual programs can be found on our website under the Professional Education tab, Virtual Programs and Resources. Our website is www.partnershipmch.org. We also offer on-demand recordings of many of our programs, and they'll be listed there as well. I hope you can join us at our next educational event. Thank you.
Thank you.